Sounds like Delegate Saab is got an echo there. Hello and welcome to the what are we? Health Occupations and Long-Term Care Subcommittee. We have, I don't know, 5 or 6 or 7 bills on our agenda today. We are going to discuss them. We're going to vote on a couple of them. We're going to come back for our regular meeting time on Thursday. So we're going to start by discussing House Bill 1034. Then we're going to do 1208, 625, 1241, and close out the day discussing House Bill 1073. We're not going to discuss House Bill 66 today. So I'm sorry that was on the agenda. We didn't have time to take it off, but it's not ready to go. So we're not going to discuss House Bill 66 yet. So with that, let's start with House Bill 1024, which is a LISA bill. We did discuss this at our last meeting, but let's go ahead and do an update. And I think we are ready to vote on this one. Lisa, can you remind us about this bill?
This bill renames the State Board of Examiners of Nursing Home Administrators to be the State Board of Long-Term Care Administrators and requires that an individual must be licensed by the board to practice as an assisted living manager in the state beginning on October 1st, 2024. There are some extensive, or there's a reprint, I guess, of the amendments. That is on, it's in the second pack of amendments that were sent out. On that first page, though, page 10. And I believe Michelle is here from Delegate Pena-Melnick's office to kind of go through the reprint.
Excellent. Welcome, Michelle. And I know we talked about this last week, so you don't have to give us too much detail, but let us know sort of anything that's changed since last week. Thanks, Michelle.
Yes, so thank you for having me again. The reprint really just puts all of the amendments we discussed last week in one document. It's a little bit easier to understand. There is a slight amendment that Dana Kaufman can explain with the language. Then we added one more amendment that requires, there's a current bill passed last year that would alert the Office of the Attorney General for any representative payee that is an assisted living manager. So one of the amendments would just send that information to the board as well. And Dana, if you would like to.
Great. Yeah, let's hear from Dana and then we'll see if we have questions from the committee. Dana?
Okay. Thank you very much. The amendment that Michelle was alluding to, so on, and I'm going to look at the reprint for 1034 on the top right, the page number. So it says 2 of 26. So we had to bring in section 19-1807 of the Health General article because the bill not only licenses assisted living managers beginning October 1st, 2024, but another big component of this bill is it is requiring for the first time those managers who are currently employed in programs that have less than 5 beds, they have been exempted from the 80-hour training course and the 20-hour continuing education course. So they now will be required to take that course. So that's spelled out basically in 19-1807, but it turned out, and we kind of figured this out later because the amendment office made a couple changes. At the end of the bill, on page 26 of 26 of the bill, there's a new uncodified section 5 that just clarifies that these individuals who are employed in homes that are licensed for 4 or fewer beds have until September 30th, 2024 to take that manager course, which pretty much then aligns with the date when licensure is required.
Okay.
And I can go through the other amendments or however you want.
Well, I see questions already. Let me just check in with Sierra Lee because she's here. Do you have anything that you want to add, Ms. Lee?
Hi, good afternoon. Thank you, committee and Madam Chair. I just wanted to clarify some things from that Delegate Saab had brought up last week in regards to some of the fiscal and financial things that we had discussed. So I just wanted to emphasize that our board is generally funded. And what that means is that the budgetary appropriations that we request and that are approved are for our board's spendable cash and for our board's expenditures. That includes, but not limited to, positions, salaries, and fringe benefits, and general operating expenses. According to our board's fiscal officer, the revenue that we typically bring in is less than approximately a quarter of our expenditures. And so with the addition of licensing assisted living managers in Maryland, increasing the original fee would essentially bring our revenue more in line with our general expenditures. And this would actually close the gap between revenue and expenditures to shrink our revenue deficit.
Ms. Lee, you're muted.
Oh, I apologize. Thank you. I guess I'll start over.
We heard you up to bringing in line, that you were bringing it in line with the expenditures.
Okay. So just bringing it more in line with our general expenditures, and that would actually close the gap between our revenue and expenditures to shrink our revenue deficit. Our board's last increase on the original license fees was done in April of 2013. Increasing our license fees, like we said last week, to $300 would be more comparable to the fees of other health occupation boards. However, after reevaluating the calculations with our board's fiscal officer, the board is open to compromising on lowering the licensing fee from $300.
Okay. And that's based on the conversation that Delegate Saab started last week. So let me go ahead to before we go to Delegate Saab, if it's okay, I want to go to you, but just since we discussed so many amendments on this, maybe, I'm not sure if this is a question for Michelle, but I'll go to Michelle and you can defer to whoever. Can you just tell us in 4 sentences now, with all the amendments, what does this bill do and why do we have it?
So currently, assisting living managers are not regulated by the state. This would bring them under board supervision, oversight, just to provide a better quality of care for our residents that are in these facilities. We took existing regulations for current assisted living managers that apply to beds 5 and over. And by licensing these managers now, that would apply these current regulations to those in 4 beds and under.
Excellent. Thank you. Now, Delegate Saab, go ahead.
Thank you, Madam Chairman. I'm sorry, I may have missed towards the end. So what was the verdict on the fees for the license?
The verdict on the fees we're actually open to just compromising on a lower amount from $300. Because $300, like we said last week, we did the calculations and the revenue was way too high. So we are general funded and we don't want to have too much of a revenue deficit gap, but lowering it from $300 would be best at this time.
So you think lowering it is advisable because you would end up with too much money if it were $300?
Correct. Correct.
So
and
do you have a point that you think is appropriate?
Right. That's.
We were thinking we can maintain it at 200 or 250. 250. So now, the original license fees are $200, and that would, with the incoming licensees, that would actually.
It's about 680,000, I think.
Correct.
Correct. That's still. Isn't that still a lot?
680,000, but then that would actually give us 135,000 carryover. And so what we do not keep that revenue, we actually it goes back to the state. So everything that money actually is utilized for all of our operating expenses and expenditures for the board. And I also want to point out that we are currently budgeted for 3 positions. And then in the fiscal note, we have 4 positions that are outlined. And so those would be 4 additional positions added to what we currently are budgeted for. So in totality, it would be 7 positions. So that is in our revenue, and the funding would go towards part of those values.
Now I got another meeting.
So it sounds like,
No, I've
I
got
don't mean to
another-
cut you off, Delegate Saab, but we've got a lot of noise going right now.
That's not from me. I guess that's from Van Dorsey. But what I was trying to say is,
You were getting at
Yeah.
keep it the same, keep it at 200, right? Or you're getting at reduce it even from the existing fees.
well,
Well, we
I mean,
can
are you talking to me or to Sierra?
I'm asking Delegate Saab what his question is, and then Sierra can answer it.
Right, so how many more positions? You said it's 3 positions, right? And I don't have the fiscal note in front of me, but I remember it was like maybe 2 something, the fiscal note, or 300.
In the fiscal note,
Well, I guess what are you anticipating it to be? Because you just said that it's going to need different. So what do you think the fiscal note would be by creating those positions? And I think we can maybe work off that, because honestly, why should we charge them a higher fee and then send it back to the state? I think
what I'm hearing, Delegate Saab,
that's-
is that Ms. Lee is open to not increasing the fee with this
correct.
legislation.
We're open to not increasing the
feasible.
fee to 300. Correct.
We would have to do an amendment on top of all these other amendments to take that out, but.
So leaving it
sounds
at
like-
200.
Yes.
I think we can agree to that. I'm seeing heads nodding. Michelle, is that something that you think the chairman, vice chair would be amenable to?
Yes,
Yeah.
she is amenable to that.
Okay, so Lisa, we would need to get that language in the amendment somewhere.
And that would leave us with 150,000 as revenue deficit.
On what page are the fees specified in statute? I didn't.
Delegate Saab, do you see?
No, actually, hold on.
Let's see from Dana. She's got her hand up. She might have an answer for us.
I was just gonna, oops, hold on. It's not, oh, no, there it is. Yeah, I was just gonna say the fee is not specified in statute. I think it's specified in regulation. So you could take that.
That's usually the
section
case.
that says it and add the fee, but it's done through
We
regulation.
don't need it in the statute, so I'm sorry if I'm
Yeah.
confused to what Delegate Saab is referring to. It's just a fiscal note prediction that doesn't need to come
Right.
true now.
You
Right.
could get a
Correct.
letter from the board saying what the fees would be.
Correct.
Okay, thank you. I appreciate it. Like I said, I just
Thank you.
think this is a good. What about the penalties? Are there any penalties? Will they be any?
So yes, I believe we added amendments regarding the penalties. And Dana, would you like to speak on the penalties,
Sure.
the amendment for the penalty?
Yeah, Delegate Kelly, you want me to speak?
Please do.
Okay. So if you look on, there's a few pages, a few different areas where there's penalties. So the first penalty or fine would be at the top where it says page 20 of 26. At the bottom, line 29, we reduce the penalty from 5,000 to 1,000, and on the next page from 10,000 to 5,000. And we did the same things on lines 10 and 13. And these are for, violations of the 17 items that begin on page 19 and end on page 20. And then there is another fine. It's a civil money penalty, actually, that is $10,000 for failure to be licensed. Basically, are practicing without a license. And we did put in a caveat that says that the board can't impose that penalty for the first year after licensure unless they provide the individual with written notice, 60 days, and then give a 60-day period to comply with the licensure requirement.
So in practice, that would work that if someone was identified as not in compliance, they would get a notice and have 60 days to proceed with getting a license rather than getting the $10,000 fine during the first 12 months.
Right. And it would be proceed to start the process because, there could be a situation where they would also, there's another provision in this bill that says that they have, if they needed to take the manager course, they can be a manager, and as long as they're enrolled in a course and complete it within 6 months.
Delegate Saab, do you have another question, or is your hand still up? You're
No,
good.
I'm
Are you
good,
good
thank
with
you.
those penalties and the changes to the penalties? Okay. Any more questions? I saw Delegate Collison had her hand up, but I think it's not up anymore.
We're good.
Okay, everyone is good. So we have a monstrous amount of amendments, but it seems like they made the bill better. So everybody is happy with them. Does somebody want to move the amendments?
Madam Chair, can I just add one more thing just for
course.
clarification purposes? Okay, thank you. I just wanted to make clear that for fiscal year 2025, there will be a $150,000 carryover with the expenditures that we're projecting.
Great, thank you for the clarity on that. Does someone want to move the amendments?
Move the amendment.
Second.
Excellent, moved and seconded. Any further discussion on the amendments? All in favor of the amendments, say aye. Anybody who's opposed, put your hand up in the chat and we will count you. Everybody loves the amendments. Thank you, team, for working so hard on these amendments. On the bill as amended.
Move the bill as amended. Second.
And seconded. Any further discussion on the bill as amended? I see no hands, so all in favor say aye. Aye. Anyone who's opposed, raise your hand in the chat and we will count you. Looks like this bill is passing unanimously. Great job, Delegate Pena-Melnick. Thank you so much, Michelle, for walking us through this and all of your help. Next, we're going to discuss House Bill 1208, which is Health Occupations Healthcare Workforce Expansion, which is actually the nursing workforce bill. We also discussed this a little bit last week, but we didn't get to discuss it really thoroughly. There are changes and amendments. If the committee remembers, last week we heard from the Board of Nursing and we heard from the nurses about some amendments that they needed. And we began to discuss some amendments from It Works that we may or may not need. And I'm still not sure if we need them. So we need to, I guess, have that conversation now. And in addition to that, there is another amendment that Lindsay has drafted that we will discuss now that takes that work group from the, sorry, someone's talking in the background and it's distracting me. The House Bill 975 that deals with the nursing loan repayment program. And puts it in this bill. So we'll talk about all of that. Our goal is to, we already have the money in the budget for the nursing loan repayment. We couldn't figure out how to make it fit exactly with the Delegate Charles bill, but we think that having that work group to figure out where the source of the funding for this loan repayment program in the future comes from is a really important question. So with that, I'm going to toss it to Lindsay and she can walk us through sort of where we're at with this and get us started. Lindsay. No, Lisa. Lindsay wrote it. Lisa's doing all the work on it. Lisa. It says Lisa right here. But Lindsay did the amendment. Am I wrong?
She did the last amendment.
That's
so
what
she will be back. Yeah.
Okay.
That one. So as introduced, the bill required the State Board of Nursing to issue a clinical extern certificate to eligible nursing students so that they may practice at a hospital or auxiliary treatment site approved by the Board of Nursing and perform at a hospital or auxiliary treatment site and provide healthcare services as specified in the bill. The bill also establishes a licensed practical nurse and registered nurse preceptorship income tax credit and creates a stakeholder work group to study expanding the state apprenticeship programs to the healthcare workforce. The bill also creates additional responsibilities for the Board of Nursing related to the expansion of the workforce in nursing related fields, such as requiring a marketing plan and an evaluation and allowing on-the-job experience as a nursing assistant to count toward a certification. So let's see, in part 4 of what was emailed out on page 53, there is a reprint that incorporates the Board of Nursing amendments. They strike language regarding clinical extern certificates, require the board to create and implement a they strike the language regarding clinical extern work. They strike the language requiring the board to create and implement a marketing plan. And they strike language requiring the board to create and maintain a publicly accessible website for individuals seeking licensure or certification. The amendments clarify that provisions allowing an individual to apply on-the-job experience toward the training hours for certification applies to applicants practicing as a temporary nursing assistant, and they specify that a certain tax exemption applies to advanced practice registered nurses rather than nurse practitioners. And the amendments also clarify that the certification provisions are referring to certification as geriatric nursing assistants. So those are the amendments that are incorporated in your in the reprint.
So that was like a lot of words, and this is my bill, and I know this in my brain somewhere, but I'm pretty sure the rest of the committee doesn't, and it's not hopping out of my brain so quickly. With all the amendments, so we're striking the externship program at the request of the Board of Nursing, but we're going to sort of they're going to voluntarily figure out how we can do something similar like a co-op program. It maintains the preceptor tax credit and the fix for the temporary nursing assistants, a pathway for them. There's something else that remains in the bill, right, Lisa? We can ask the stakeholders if it's not in the top of your brain either.
Yeah, if they have an answer, I'm trying to figure it out.
Robin, do you know what else remains in the bill? Robin has raised her hand, so.
Good afternoon. Robin Elliott here on behalf of the Maryland Nurses Association. At the end of the bill, there is a study that would have the Department of Health and the Department of Labor looking at the way the Department of Labor does apprenticeship programs and whether or not there's any applicability to healthcare professions. And it could include, for example, nurses were really excited about this because it could include community health workers. So we're very strongly in support of that provision. And I think there's a small amendment that also suggests that the group look at whether to call it an apprenticeship program or a preceptorship program or whatever nomenclature is common in healthcare.
Excellent. That's very helpful. Thank you. And then we have also amendments from It Works. They want to talk about the online training for the CNA and program site approval. And then we have the amendment to discuss that Lindsay wrote about the loan repayment program that we could put into this bill as well. So that's what the committee needs to discuss now. And I also had a question just for the back of our minds, and I guess this is for Lisa as we discuss this. It still contains this preceptorship tax credit, which I think is great. I think the committee likes. I haven't heard anything negative about it. Do we need to run that by Ways and Means, or are we okay to just do a tax credit here because it was assigned to us?
Probably wouldn't hurt to just out and mention it before it hits the floor. Yeah.
Okay, so we'll make sure to loop them in if the committee decides that we want to keep that in. With that, how about Lindsay, do you want to talk to us about the loan repayment amendment?
Sure. So Delegate Charles's bill was creating a loan assistance repayment program for nurses and nursing workers. And if you recall, there's $2 million in the budget under MHEC rather than this program, which is under MDH, for loan repayment assistance for nurses. And then there was no permanent funding structure for Delegate Charles's loan repayment program. It was anticipating money coming from the Board of Nursing, and then a stakeholder work group was going to be trying to identify a permanent funding structure for the program. So the Delegate Kelly requested an amendment to, rather than passing Delegate Charles's bill, leave the $2 million with MHEC where it is in the budget, no changes there, and then have this work group convene, no changes to the membership from Delegate Charles's bill, to come up with, rather to examine how the state can implement a loan repayment assistance program for nurses and other health practitioners that are regulated by the Board of Nursing, including coming up with a permanent funding structure for such a program.
Excellent. It looks like Robin Elliott has her hand up again. Yes? No?
Oh, sorry, I forgot to put it down.
Okay, Delegate Cullison has a question. Go ahead, Delegate Cullison.
Thank you, Madam Chair. So the study group could examine the feasibility or efficacy of moving the money that's in MHEC into the loan repayment program under MDH. We're just not doing it now. Is that something that
the money that's for the $2 million for MHEC is in this year's budget? So this group wouldn't be changing that anyway. That would have to have been done by a budget amendment during this session. But they could they would presumably be looking for a more permanent funding structure other than an appropriation from the governor.
That's right. I forgot that's like an annual allocation, but okay, great. Thank you.
And I see Rhonda and Iman from the Board of Nursing are here. Do you have anything you want to add to that? Is this acceptable to you all approach to this? I think they're here. I see Rhonda.
Hi, how are you, Madam Chair? Yeah, I would have to, as far as for this now, I would have to take it back to Karen. She couldn't make it, unfortunately. She's at a conference, but I would definitely take it back to Karen and the committee and discuss it with them to make sure that they're okay with it. I don't think that I don't foresee any issues. I'm trying to remember, Iman, if you remember the discussion that we had about this, were there any concerns?
I think the concern was largely that we didn't want to immediately determine it would come from licensing fees, that we wanted to sort of have this conversation. So that's what I last heard from Karen, which is why we sort of are approaching it in this way.
Okay. So
you can check back with her and let us know, but I think that this is the direction that she wanted to go in.
Okay, yeah, absolutely. Because if this is the bill I'm thinking of, we did have a discussion and concern about there not being enough money in our fund to even cover these fees. And like previously mentioned, a more permanent funding source would definitely be more appropriate. So yes, but I'll follow up just to make sure.
Excellent. I'm concerned though, because I think we have Neil here from It Works to discuss their amendments. Are you here, Neil?
I am here, Madam Chair, and apologies for being off camera. If you don't mind, I could still make my comments.
No, absolutely. I'm concerned if Karen's not here. I'm not sure we know the Board of Nursing's position on your amendments. I know that they're important. I'm not sure if we need to put them in the bill or not. So let's just start with the conversation and see where we can get.
Sure. I mean, I think we talked about it a bit last week, and we totally heard Karen and the Board of Nursing's perspective on it. But I just want to reiterate to the committee that Ms. Evans said that the Board of Nursing already approved Beacon for a hybrid program, and we're really happy to hear about that progress. I know it's been a couple of years that they've been seeking that opportunity, and the pandemic really gave schools like It Works an opportunity to do just the same. It Works was able to train about 1,000 people through their online training program. And now that we're, the light at the end of the tunnel is near, we found that those programs are still something that people want. And we know that the Board of Nursing prefers more of a hybrid model, one where clinical training is done in person. And we think that makes a lot of sense. But your amendment really, gets at what would be helpful to schools like It Works. If standards are clearly outlined for the online aspect of training, it would presumably streamline the process for that part as far as application goes, and just make it clear that this is something that Maryland is open to do. Secondly, with the respect to the amendment that has to do with approving training sites that have been previously approved, we heard from the Board of Nursing last week that they have their own process. We understand that. And Ms. Evans did say that these types of applications for approval generally go quicker than others. That being said, I know it's taken some time for my client and presumably for others to get sites approved that have already been approved before. And that can be due to, that could be due to several issues on Board of Nursing's end. We know that there was a cyber attack. We know that they're understaffed. We get all those issues, but that still doesn't really help the schools themselves. So we would really urge the committee to vote in favor of these amendments, but certainly, willing to continue to work with the Board of Nursing to make these issues easier for everyone.
Okay, and Rhonda, do you have any response to what Neil is saying on particularly the two amendments, the one that requires the standards for online provision of all aspects of a nursing assistant training program, and the other that requires the training program within 14 days for approving the use of a nursing assistant training site by a nursing assistant training program within 14 days after it applies for approval if it has been previously approved. Oh, I think you're on mute, Rhonda.
Sorry about that. Yeah, so it sounds like the amendments are just specifying a shorter time frame, or it sounds like maybe expediting approval of these programs if they've already been approved. I guess my concern is that I'm not sure, because there are other factors that could prevent the site from being, the site visit and things like that. I'm not, sure that approving it right now, or at least agreeing to it right now. I think we would need further discussion, which I haven't had on this topic at all, so I'm not sure.
We have a question from Delegate Cullison. Go ahead, Delegate Cullison.
Thank you, Madam Chair. My presumption reading this amendment is that there would be a thorough analysis of a site initially, and and we would assume that nothing about the site changes the next time they want to use it. So you don't think 2 weeks is enough time, given it actually puts more work on the board to have to go do another complete analysis of a site. And it also delays the accessibility of the site. So I guess I'm wondering why you think 2 weeks isn't long enough, since it's a subsequent approval.
No, I'm not saying that it's not long enough. I just was hesitant to agree without knowing fully what the what it would entail. But I mean, if it's already been approved, I don't foresee it being an issue. But again, speaking to what the education department does as far as site approvals, I wouldn't, feel 100% comfortable that it would be enough. But I mean, if it's, we don't want to further delay, the accessibility of these sites to, students. So,
yeah. Thank you, Madam Chair.
Thank you. I'm going to ask Dana Kaufman, particularly on the amendment that has to do with the online education. If you have a position on that, do you think we need that?
You mean
she's still here?
No, I am. I'm still here. I was actually listening to the Senate too.
Oh, I'm sorry for the It Works has, we have two amendments that they're presenting. One we just discussed for sites that have been previously approved. And this one is adopting regulations, standards for the online provision of all aspects of nursing assistant training program that meets the requirements established by the board.
Yes, that was that amendment was in the discussion last week as well. And thank you for checking, but we're fine with both of them.
Delegate Riley.
Thank you, Madam Chair. Yeah, I just had some questions kind of going back to the funds for MHEC. My understanding is that we're not going to incorporate that money from MHEC because it's currently in the budget. So we're not going to touch that. Okay. So in the future and currently as the bill stands, will this affect the nursing programs that we currently have in our community colleges? Does that, how did our community college program fall into this bill? So I would assume that the MHEC money was used for students that,
so this bill before us doesn't have any money in it at all. It's really just trying to eliminate barriers and get people licensed in a timely way and make sure that we can do loan repayment as necessary. That's really all. And there's a couple of studies and the preceptorship credit. So it would, if the preceptorship tax credit, goes into effect, then that would help us have preceptors, which would help all of our educational institutions place their students.
Okay, so if that portion doesn't go through, then because I hear you talking about new locations, for this or online, which some of our colleges have online, but I know the nursing programs that our current colleges have, community
Neil,
colleges,
can you explain the It Works business model so that Delegate Riley understands what these amendments are relating to?
Yeah, sure. Thanks, Madam Chair. And Delegate Riley, It Works in particular is a training school that trains folks to be CNAs and GNAs in particular. So we're not talking about more of the
Okay,
advanced
so they're
research.
current and they're training for these programs. Okay.
Yeah, it's ongoing, and it's something that they've done throughout the pandemic, and they've been able to train about 1,000 people throughout the pandemic.
Okay, awesome. Or do you know if any of our community colleges offer those courses? I know most of them are probably, like you said, from the beginning, becoming a nurse, but.
Yeah, I'm not sure. I can't speak to that, but I think that's the way of the future, to be honest with you.
Okay. All right. Thank you very much. Thanks, Madam Chair.
Absolutely. So I know we've been a little bit all over the place, and I apologize. That's been the way of the world with this bill. But the intentions of this bill are really to just strengthen our nursing workforce and make sure that our employers and our licensing board are working together efficiently so that we can accomplish that goal. So with that said, let's think about moving some amendments. So we have, I think together, tell me if I'm correct, Lisa, in one set of amendments, the Board of Nursing amendments, right, that we need to move?
So yes, that's what the amendments that are you see in the reprint are the Board of Nursing amendments.
Anybody want to move those?
Move the amendments.
Second.
Moved and seconded. So for the Board of Nursing amendments, any further discussion on those? No. All in favor, say aye. Aye. Anyone who's opposed, raise your hand in the chat. I don't see any hands up. So then we have the loan program amendment that Lindsay described, which takes the language for the work group to discuss sort of future ways we can do the loan repayment and puts that into this bill. Anyone want to move that one?
Move the amendments.
Second.
Perfect. Any further discussion on that one? I see none. So all in favor, say aye. Aye. Anyone who's opposed, raise your hand. Speak now or forever hold your peace. Excellent. Now we have two It Works amendments, which I think we can move together. Is that right, Lisa?
Together, yes.
Yeah, we can move those together. Okay, so anyone want to move those amendments?
Move the It Works amendments.
Moved and seconded. Any further discussion on those amendments? Okay, all in favor, say aye. Anyone who's opposed, raise your hand. Perfect. We have adopted a pile of amendments. I neglected to mention, and I don't know if we have to revote on this or not, but in the loan repayment program work group, we wanted to make sure to add leading age in there. I think we have other, Lindsay, who's in there? I'm so tired. I think we have lifespan maybe, but not leading age.
Right. It's got the Secretary of Health or the Secretary's designee, a representative from the State Board of Nursing, the Maryland Nurses Association, 1199, HFAM, MHA, and lifespan.
So I'm gonna add another amendment just verbally. We're gonna add in, if the folks are okay with this, I'm gonna move to add in leading age so they can be part of that conversation too, because I know it's important to them and they're great stakeholders in this space. Anyone want to second that?
Second.
To all in favor, any further discussion? All in favor, say aye. Anyone opposed? Perfect. Okay, so now we have a mountain of amendments on this bill and a lot of stakeholder work together on it. Anyone want to move the bill as amended?
Move the bill as amended.
Excellent. Moved and seconded. Any further discussion? Okay, all in favor, say aye. Anyone's opposed, raise your hands. Passes unanimously. Thank you to everyone for your work helping us strengthening our nursing workforce. Moving right along, Commission to Study Healthcare Workforce, another pain in the neck, Delegate Kelly bill, I apologize, team. This is a bill that Lisa is working on with us. It has already passed the Senate and the Senate has put some amendments on it. We can discuss the Senate amendments. I'm not sure we want to take the Senate amendments, but we do have some other minor amendments, I think, that came to us from stakeholders that are in our reprint. Let's go to Lisa and hopefully she will help.
So these are not the Senate amendments. These are your amendments. That was the last thing I was told to.
No, and that's what we want, because I'm not sure we want to adopt the Senate amendments. I just want the committee to be aware of the Senate amendments, because this is a commission that is, taking more time than anything should.
So these amendments were, they're on page 6 of the first packet that was sent around. They add the Secretary of Labor, the Deputy Secretary of Behavioral Health, and the Executive Director of the Maryland Longitudinal data system center to the commission. They require the commission to establish advisory committees or stakeholder work groups and specify the membership of the advisory committee and stakeholder work groups. They add to the list of settings for which the commission will determine if there is a shortage. They require the commission to specifically study wage increases as a strategy to reduce turnover. They require the commission to consult with the Department of Veterans Affairs, and they require the commission to study barriers to licensure for foreign-born health professionals.
Okay, I see Robin Elliott's hand up. Do you want to go ahead, Robin?
Yes, thank you so much. Maryland Nurses Association, of course, just wanted to mention a few things with this, and I did review the Senate amendments, which I can relay if that's helpful. So what the Senate did is very much narrow the bill to anyone licensed under Board of Nursing, Board of Pharmacy, Board of Physicians, and Board of Professional Counselors. The nurses like the bill as is, in terms of its broad scope, because really healthcare is a team approach, and nurses are concerned about shortages with social workers and speech pathologists. And the bill kind of as introduced would allow all the healthcare professionals to work together to determine what is a priority in terms of shortages. And so I'm happy to, I have a couple of other specific comments, but I'm happy to hold whenever you're ready.
Let's see if we have questions from the committee. Any questions at all from the committee? I see a lot of tired faces who remember already discussing this bill in the past. So it could be the committee has all their questions answered already and just wants to move these few amendments that made a lot of sense to me and are in my name. So any questions at all from the committee? I have heard, I think we've all discussed and heard from stakeholders in the past that there's a need for this. We don't want to just willy-nilly do commissions for no reason, but in this space, I think there's a desire to answer some of these really important questions. So I'm going to move the amendments.
Second.
Any further discussion of the amendments? I will just state that we are knowingly passing this bill out, not in the same posture as it's coming over to us from the Senate. So this bill is not resolved yet. We will have to figure that out with them. And I apologize. Delegate Bagnall.
Thank you, Madam Chair. And I
Oh, you're kind of going in and out, Delegate Bagnall.
sorry, I don't know why it muted, remuted. I would like to sort of second the intention of keeping it broad so that we can look at our healthcare field as a team effort, having encountered some of these challenges where we just can't come to consensus. I think that keeping it more broadly focused is in the best interest of making movements on some of these issues.
Great, thank you so much. So the amendments have been moved and seconded. All in favor say aye. Anyone who's opposed, raise your hand. Looks like it's unanimous on the amendments. On the bill as amended.
Move the bill as amended.
Second.
Seconded. Any further discussion on the bill as amended? I see nothing unless Robin Elliott's hand is up for a reason. She's not a member, so we don't really care if her hand's up, I guess. All in favor say aye. Anyone who's opposed, raise your hand. Aye. Okay, passes unanimously. Thank you. Go team. We're moving right along. What's next? Really? Okay. Next on my list is another Delegate Kelly bill. You guys got to put in more bills here in this space. This is the nursing home administrator bill. It is not ready to go. It is ready for a conversation. And then after this, we're going to have a conversation on 1073, which is Delegate Cullison's Advanced Care Planning Documents bill. So let's see how much time. I have 15 minutes left on my clock. So let's do 7 minutes on this and 8 minutes on Delegate Cullison's bill. Lisa, can you tell us what House Bill 1241 does? And before you go, Lisa, let me tell the committee that my staff pulled together a stakeholders meeting on this bill yesterday. We were really hoping to reach some consensus. I apologize that we have not yet. There seems to be some disagreement as to whether there is a shortage in this area. So we'll hear from the stakeholders over the next 7 minutes and see if we can close that gap. Lisa.
This bill authorizes an individual who holds an active nursing home administrator license in good standing in another state to practice in Maryland if the individual has a minimum of 3 years of experience as a nursing home administrator or 6 years of experience as an assisted nursing home administrator. The State Board of Examiners of Nursing Home Administrators must waive any education requirements for an individual who was licensed, remains in good standing, and practiced as a nursing home administrator for at least 3 years in another state. The bill authorizes an individual to satisfy the experience requirements for a nursing home administrator license if they have either completed 9 months of full-time nursing home administration in a nursing home or have completed 6 months of full-time nursing home administration in a nursing home, and have completed an internship in a nursing home or assisted living program, hold an active certification issued by the State Board of Nursing, and have at least 10 years of experience at a nursing home, or have at least 3 years of experience as a director of nursing.
Well done. Thank you, Lisa. Let's hear, I know we have Joe D'Amato's here. I see Sierra Lee is here. So let's hear from Joe first and we'll see sort of where we're at, why we think we need this bill, and then we'll hear from Sierra. Go ahead, Joe.
Oh, thank you so much, Madam Chair and members of the committee. It's good to be here. I'll be quick. So this bill does not, let me talk about what it doesn't do real quick. It doesn't eliminate the education requirement, the test, or the administrator and training program. It doesn't reduce below the current standards the administrator in training program, does not. Currently, under current law, the Board of Nursing Home Examiners can reduce the 1 year AIT, the 1 year internship that isn't required by statute to be paid, but most providers pay staff during that time. The board can do that now. It can reduce the IT from 12 months to 9 months to 6. What this bill does is that it says that the board shall reduce it to either 6 or 9 months based on the years of service that somebody has as a licensed professional in a nursing home. So it takes what's currently a may, makes it a should, and it goes the extra step and says, you can have criteria for that. You can say, you can require somebody to work in a nursing home for 10 years or 3 years and be licensed as a CNA or as a nurse. So that's what it does. We've heard from the Board of Nursing Board of Nursing Homes Examiners that they're not sure the scope of the problem. In our stakeholders call yesterday, they acknowledged maybe a little bit more that it was a problem and a national problem. They don't believe that this fixes it. We think it's a step in the right direction to fix it. We don't think that provisional licenses issued or jobs posted on a job board are indicative of how many people are being recruited by headhunters or who want to enter our market. Really, what we're doing here is what Delaware does now, pretty much exactly the same. So that's my teeing up of the issue, Madam Chair.
Excellent. Thank you so much. Sierra Lee, did you want to add your perspective on this one?
Yes, and thank you for this opportunity, Madam Chair. It was really insightful, and we do appreciate the opportunity to head this to work on the stakeholders meeting that we were in yesterday. We definitely, through that meeting, had some concerns that came from the language of the bill, and I'm going to actually have our board counsel, David Wagner, speak to those concerns.
Thank you. Mr. Wagner.
Yes. Hi. Thank you. The Board of Nursing Home Administrators was not enthusiastic about this bill to begin with. Watering down the credentials of the administrators was probably not the direction that we wanted to go. But right now, the main problem is the drafting in the bill. It was presented to us as a very narrow bill to fix specific things, but the ultimate consequences of the drafting was really to prevent anybody. It would have the consequences of preventing anybody from being licensed in this state. There are really two main avenues for licensure. One, going through the AIT program, which is a one-year program in a nursing home, or if you're out of state, having practiced for a year as a nursing home administrator in another state. But they took out the "or" in that. So one would have to do.
Mr. Wagner, let me stop you for a second and I'm sorry, I don't want to waste the committee's time, but it sounds like what you're describing is a technical drafting error you've identified that we could certainly fix with a series of amendments. My understanding is that the board is opposed to the bill on its merits and doesn't want to see that change. So there's no point in us making those technical fixes. Is that accurate, an accurate reflection?
Well, we certainly think it goes way too far. For example, if it were drafted, I think what they had in mind intended, it says that somebody who had an internship program in an assisted living program or a nursing home administrator would get half of the training program cut off from 1 year to 6 months. But we don't even know what an internship is, or it would allow a certified nursing assistant to cut the training in half as well from 1 year to 6 months. And we think that goes way, way too far. I mean, there's a big difference between being a certified nursing assistant and a nursing home administrator. We don't think that one cuts off half of the training. So even if this were drafted in the way that it was intended, there would still be very substantive problems with it in terms of the quality of care that nursing home administrators, that nursing homes would receive.
Okay. Do we have questions from the committee for these panel at all? We've got 23 extra seconds, so I'm just going to ask Mr. D'Amatos, can you just respond a little to what you have heard? It's clear that you think there is a shortage and that you think that the training requirements are adequate. Can you speak a little bit more to that?
Yeah, as we discussed, thank you, Madam Chair. As we discussed yesterday on the stakeholders call, and I really appreciate my interaction with Sierra Lee on the call and also in emails last night. So let me make that clear. We made it clear that the word internship in the bill was put in place as a description of the current AIT. Our testimony has been clear from like moment one that we're not reducing the AIT training beyond what is currently provided in law. Relative to Mr. Wagner's most recent comments with regard to a CNA, I find them troubling. As I explained in my testimony, we have a great deal of diversity in our sector at the entry level. And the higher up you go in healthcare and the higher up you go in skilled nursing and rehab centers, you have less and less diversity, specifically ethnic diversity. And so I'm troubled when somebody says that if a CNA with 10 years of experience as a CNA, who holds a degree, who takes an exam, who does a 6-month AIT, is not qualified to be an administrator. Right now, that same person in Maryland could be approved as a provisional administrator with none of that. So that's my response.
So much. So we're going to come back to this. We used our time, so we'll let the committee sit with it. I don't see any hands up. Thank you to everyone for sharing your perspectives on this. And let's move on to Delegate Cullison's bill, which is our last bill for the day, House Bill 1073. Delegate Cullison, I see you are here. I know there are a whole series of stakeholders here, so if you could help guide us through who we need to hear from in this first part of the conversation, that would be helpful. First, we will hear from, I'm going to go with Lisa. Lisa, yes.
Okay, so this bill alters the components of the Advanced Directive Information Sheet prepared by the Maryland Department of Health and requires the sheet to be provided by additional entities. It requires the Maryland Healthcare Commission to coordinate the accessibility of electronic advanced care planning documents in the state. It repeals the requirement that an electronic advanced directive service be established in a certain manner to connect to the state designated health information exchange. It requires healthcare facilities, nursing homes, and assisted living facilities to take certain actions regarding advanced planning documents requires Medicaid, managed care organizations, and health insurance carriers to take specified action, and requires the Motor Vehicle Administration to submit a specified report by December 1st, 2022. So there is a reprint that is, let's see, it was part 3 of the emails that were sent out. The amendments clarified that the Healthcare Commission and CRISP will develop an electronic platform to which individuals can upload advanced planning documents and update the documents, and through which providers can access the documents as appropriate. The amendments streamline and clarify the requirements on facilities and carriers and MCOs. They exempt community providers, home health agencies, hospice facilities, and certain assisted living facilities. In response to some comments from the Health Education and Advocacy Unit, it strikes language referring to a document designating a healthcare agent, because apparently that can only be done through an advanced care directive. Requires the electronic platform to provide non-visual access, and it strikes some repetitive nursing home and assisted living provisions.
Thank you. Delegate Cullison, go ahead.
If I might have just a few minutes and then we can hear from the advocates. So I just want to make sure that folks truly understand, because this is the first time we've had the opportunity to discuss this bill. The intent of this bill is to help encourage more Marylanders to upload their advanced care directives so that they are accessible when needed. And this is not something that people want to talk about. They don't want to, describe what kind of care they need. Should they be in a catastrophic or tragic situation with an accident, or at home and an aging individual. So it is helpful for them, for their families, and for the healthcare providers to know what their wishes are. So this bill was designed to give them every opportunity through several different healthcare portals to hear why this is important to do, and to be given a link to a secure platform that MHCC is going to work to identify, so that it can be those documents can be uploaded and are accessible to the family themselves, but also to healthcare providers as needed. So apparently the struggle we're having is around the technological pieces and the accessibility of the technology. I think, we've worked very hard on this bill. All of the advocates have worked really hard on this bill to try to get us to a place where people could be comfortable with it. So with that, and I don't know how much time you want to spend, Madam Chair.
We have 6 minutes and 30 seconds. You're welcome.
So, knowing that we're going to discuss this again on Thursday, and I am also going to say that between now and the next time we meet, I am going to work with a group of stakeholders to see if we can wrestle through some of the remaining issues. But I think if we start with Dana has her hand up, so let's go with Dana. So Dana first.
Thank you. And I just have one comment, and I very much appreciate the home health agencies and the hospice taken out. The bill does leave in an assisted living facility. It's supposed to be defined as 19-1801, so just FYI, it says 801. But it only exempts out those with single ownership by an entity of less than 10 beds. I think that means you only own one, not that only one person owns one or owns that one. So I think that needs to be fixed a little bit. But more importantly, I am very concerned with less than 10 beds, because even for those that are more than 10 beds, especially the 10 to 17, it's my understanding, and I was trying to look through the other sections of the document, but it still says that the electronic platform will be through CRISP. So it's always been my understanding that in order to be through CRISP, you have to have electronic health network. And assisted livings, for the most part, are not connected to CRISP. Basically because those individuals who reside in assisted living, we don't have medical directors typically, so that they have private physicians. So requiring them at this point to also then get electronic health network or record to be able to do that connectivity is going to be, I believe, expensive on them. And I'm just concerned because so many of them right now are running low census and they received no money from the COVID relief. And also they, the reason that hospitals and physicians were able to connect early on is because they received federal and state monies to actually purchase electronic health records and connect to CRISP. That hasn't happened now. So my only concern is I would like them to be exempted out totally, and then we can always bring them back after we understand more on the electronic health platform that's being used. And we have a better grasp of how many have them, who doesn't. I'm really concerned about that issue now, especially since, we just passed the licensure bill, and that's a huge policy initiative affecting them. So that's my point. And I welcome the opportunity, as always, to continue to talk with Delegate Cullison on it.
And we will. Thank you. That's really helpful. Sorry.
No, it's okay. I think we have a few more minutes, and I know there's a lot more stakeholders here. Do we want to hear from someone else? I see Kathleen Loughran's got her hand up.
Wait a minute. Who has her hand up?
Kathleen Loughran's got her hand up.
Kathleen. That's right. Oh, the physical hand. Okay.
Yes, go ahead,
I'm sorry. I don't have the other hand for some reason when I log into your discussions. But thank you, Madam Chair and Delegate Cullison. The MCO Association, certainly supports your efforts to push this effort forward and get this information out to everyone. For everyone's benefit, I want you to know that the MCOs today are already required to provide this information to their members. It's in the member handbook, regardless of whether that's a paper form of the handbook or an electronic format. And the information that you receive is a link to the AG website, a link to MDH website, the actual form to print, as well as a statement of the facts or the frequently asked questions that's published by the Attorney General's office. So that is already being provided to members. We are a little unclear on what this future world will look like. So I think I would reserve judgment and opinion till further conversation on that. The most immediate concern that we would have is on page 13 of the bill, page 8 of the reprint. Managed care is included in the definition of carrier. And you're probably tired of me hearing this as much as I'm tired of saying it, but you cannot put an MCO there and expect that to be applicable. And it's inappropriate largely because we are not in the insurance article and we are not regulated by the Insurance Administration. We are our own defined entity in the Health General article. So what I would propose is strike us from the definition of carrier. The language that you have at the top of page 13 that is protective, I believe, of carriers regarding whether or not they would have to provide, actually it's top of 14. It says that we want to assist in a member. It's paragraph D for Lisa on top of page 14 of the reprint. Move that language over to the bottom of page 6. So those same, or at least copy it, put it in the MCO section so that it's clear that we're not advising our members about whether they should or should not sign an advance directive.
Right.
So those would be my two technical points for now. And then I look forward to additional conversation. Thank you for your time.
Excellent.
Thank you.
I know that we have the carriers here also. I see Matt Celentano, I see Kathy Grayson, I see Allison Taylor. Do any of you have anything you want to add for this first part of the conversation?
I'll jump in first if that's okay. We're putting together some detailed recommendations, so we're happy to talk to Delegate Cullison offline and hopefully figure out if there's a path forward solution wise on our issues offline.
Okay, perfect. And all of this is going to be happening in a somewhat timely manner because it's crossover week and everybody knows that. Anybody else who has anything else to add right now to this conversation? I see no more hands up. Delegate Cullison, anything else you need to add? Ben Steffen has raised his hand. Go ahead. Let's hear from you, Ben.
Thank you, Chair Kelly. 30-second comment. I think that this work, putting together this bill, was the outgrowth of a work group that convened over the recess. Most of the stakeholders participated. And I think don't lose sight of the fact that we're asking everyone to do a little bit, and don't be confused by the fact that there is an electronic technology framework with this, but it is making advanced directives accessible. That's the most important theme. Don't be confused by the fact that we are using technology. We'll try to make it as simple as possible. We think it's accessible today. The features in the system today are available. And if we all provide a common message, construct an advanced directive, we're going to have better care for patients near the end of their life, as well as patients who need critical care and can't speak for themselves. Thanks.
Thank you. Delegate Cullison, I think we're
if I
wrapping
could
up.
just, right,
Yeah.
if I could just wrap up saying, I want to really thank Van Steffen for his work on this and his commitment to helping make it work, because he just so eloquently described. So, and I, as well as all of the stakeholders who attended many hours of meetings during the intersession over this. So thank you. And thank you for the opportunity, Madam Chair.
Absolutely. And I will just remind the committee before we close that we are coming back at our regular meeting time on Thursday to pick up this conversation, as well as the dental board bill and the dental bill and a couple of other assorted bills. So we will see you Thursday. Delegate Cullison, you have a meeting announcement for Insurance Subcommittee?
Yes, the Insurance Subcommittee will be meeting